you change nutrition just because you have maybe more clue on nutrition or enzymes or digestion than others, and that's it, or whatever. And then this dog or cat is not sick anymore. And it has nothing magical, of course. But it's the way for me to make nutrition more aware by vets than just giving this food for this dog is the blue food for the blue disease, or the red food for the red disease. To me, if you do that at first, that's okay, everything's fine. But if it's not, then you have to go somewhere else.
Hello and welcome to the Pet Food Science Podcast brought to you by Wisenetics. I'm Jan Sokodolski. I'm here from Texas A&M University and I'm dedicated to bring you the latest insights and discussions that involves everything on the pet food science but also pet food itself. So get ready to expand your knowledge and stay ahead with today's episodes. And it's my really great pleasure and bonjour to Geraldine Blanchard, here's my French, who joins us today from southwest of France. She told me she can see the ocean from her office, so I'm very jealous here. Welcome, Geraldine. And Geraldine is an expert in clinical nutrition. So today the big topic is going to be clinical nutrition. So Geraldine, welcome.
Hello to the audience. Hello, Jan.
Hello. And so, Geraldine, what I like to do is usually I'll let you introduce yourself, where you come from, what was your whole, career path and so on. And then, so please go ahead.
Okay. Well, first of all, thank you for the invitation. I'm very happy to have this chat with you today. Let's go and maybe go from my background. I actually always wanted to be a vet, but an equine vet. So I think nutrition is a bit of a change. I've done some nutrition for horses, of course, in my journey, but the goal was more surgery than nutrition, I'm afraid. So I graduated from French vet school of Alfort a few years ago. Actually, it's 30 years ago this year. And after thinking about being an equine vet, I decided that maybe nutrition was also interesting, and going to be an academic would be also interesting. So I did the classic trick with PhD, and what we have in France is agrégation, and the European College of Vet and Comparative Nutrition. So I'm so-called a European specialist in nutrition, in vet nutrition. And I started teaching there until 2006. And during this time, I developed pretty much clinical nutrition. So I did some horse stuff, but also a lot with pets. And my PhD was definitely turned on cats and hepatic lipidosis. Then what happened? I decided to go away for a while and to Australia, to the University of Queensland in Brisbane, which was actually it was at this time in St. Lucia, and I stayed there in 2007 and came back to France. Well, I was teaching there as senior lecturer, and I came back to France after this wonderful experience. And I didn't go back to any university. I chose to launch a consulting company, doing nutrition, a lot of different ways, all consulting from sourcing ingredients for the pet food industry, sorting them, clinical trials, to formulation, training for the task force, whatever you can imagine around the pet food industry, or maybe a little bit inside as well. So I've done that a lot, and at the same time, I always kept a consultation, a specialist consultation for nutrition. So I was definitely always interested in clinical nutrition, and I'm still doing it, and it's a very important part of my life, even if it's not the most time-consuming one. And at the same time, and I had this idea when before going to Australia, which actually at the beginning was supposed to be a sabbatical, and so I had to make money for that. So I thought I could provide a service from internet. It was the beginning of 2.0 internet. So it started to be able to work with this distance. And very often people used to come to me, or vets referred to me or called me for formulating diets, but very often homemade diets. And so I thought it could be interesting to do that, even being far away. I had no time to do that in Australia because they hired me for teaching. So then when I came back to France, I stick to this idea. I don't know why, but I kept this in mind. And as you know, there are not many specialists in nutrition. And I thought it would be interesting to provide such a service for people if the animal was healthy, but also for vets. For any kind of situation. And the story started 15 years ago, and it's still going in French and English. And it's quite interesting to see how the demand has changed. People are definitely much more, and all the trails, all the assays which have been published during the recent years show the same, that people are much more on demand on nutrition, and they cook more for their pets than they used to do 10 or 15 years ago. So it's still a challenge because, of course, vets are not really trained to do that and to provide the good advice. They have very specific ideas, sometimes just because they have no clue of how to answer. And so they have a tendency to direct to options which may not be the best one for the dog or cat they have to deal with. So that was the point. So if we make a little jump to today and stop with my past and my career, then I would define myself as a clinical nutritionist more than anything else. I would say I'm still try to do research, and it's more clinical research, of course. But with partnership with other vets, specialists, and friends, we try to do a few, and it's probably one of the ways we know a little bit each other. And because of these discussions we may have sometimes in conference and congresses about how to feed dogs and cats with GI troubles, but not only GI. I mean, other kind of troubles.
84 million times a day, pets eat meals with ingredients from Trow Nutrition. We bring together the science of ingredients, nutrition, and blending to unleash possibilities for pet food brands. Premixes are just the start. Turn to Trow for higher inclusion ingredients too, like proteins and carbohydrates, and highly sensitive ingredients like probiotics. With our palatants and base blends, you can feel confident about what comes in our bags and goes in yours. Learn more at TrowNutritionPets.com.
No, that's really great. I think it's an exciting area because I think we're also learning much more what nutrition means, right? And how to treat it and so on, understanding also better pathophysiology of GI disease. So for you, I mean, maybe like very simple, why do you think nutrition is so crucial for dogs and cats? Why this is one of the major components of management?
Yeah, actually, it's a basic function. It's as important as breathing, nobody would contest the fact that oxygen and breath is basic, and nutrition is also a basic function. We need to eat to live. That's the very simple. Put this way, it's very simple. It may be a little bit more tricky if we go to the inside, and it's probably one of the functions which is the less well known. And if we want to define nutrition very simply, it's the way you would have food to provide all the nutrients which will be useful for the body to maintain itself living, but also healthy. Which means it will never prevent every disease, of course. But the way nutrition and nutrients have been defined and discovered as essential is very often in the past, in history, by the fact that an animal was sick people thought about giving to him something, and giving this thing prevented the other ones to get the same problem. And if you don't give it, they're sick. If you give it, they're not sick. So the first of all thing with nutrition is prevention. And it may be one of the most reasons why it's so unpopular. Because as vets, we like to care and cure and treat. So if we find options to not have any animal sick, what's the point? We're not useful anymore. So definitely one very important thing is there. The second thing is when you're not fed well, you will have functions. Some of the functions of the body will be impaired, and this way, when you try to feed a dog or a cat, you may think, and it's of course, black and white way, the easy way, and it's always the first step. We'll feed a dog, we'll feed a cat. Unfortunately, they are not genetically identical. And to me, the most challenging part of nutrition, especially these days, is to make people, and vets are inside this population of people, to make people understand that there are individual variations. And when you want to, and in nutrition, we have this ghost curve, as in a lot of other parts of science. Like, of course, you have the main population there, but on the sides, you have a lot. And as a vet, we have to treat one dog at a time. We don't treat a population. And so when you have to deal with one dog or one cat, and there's something wrong with nutrition, because this dog or cat hasn't read the book, he's just like as he is. And genetically, he may have more or less of this enzyme or this one, can be lactase, can be amylase, can be another one. And feeding it as you would do for others will make him sick, will lead you to a problem, and you'll have a problem to treat, and you'll provide drugs, antibiotics, cortisol, whatever, immunomodulators, whatever. And when you stop, you will be sick again. And sometimes, hopefully, for nutritionists, you change nutrition just because you have maybe more clue on nutrition or enzymes or digestion than others, and that's it, or whatever. And then this dog or cat is not sick anymore. And it has nothing magical, of course. But it's the way for me to make nutrition more aware by vets, than just giving this food for this dog is the blue food for the blue disease, or the red food for the red disease. To me, if you do that at first, that's okay, everything's fine. But if it's not, then you have to go somewhere else and have what I would call a clinical and clinical way of thinking, but including nutrition in it. So that's the very first step. It's a big step. I'm sorry.
No, I think it's a very, very great explanation why it's also so complicated, right? But it also means it's quite a time-consuming, right? So for veterinarian, for example, do you think they would have enough time or for those animals, it's actually ideally to bring them to a clinical nutritionist who has more time? So that's my question. How much time do you spend, right? How do you approach those kind of individual cases? They don't have read the book. So what's the daily practice?
Yeah, that's interesting. As any specialist, when I do a consult myself, it's a long consult. So it's not a 15 minutes consult, of course. And it's a real concern to me. That's the way I thought about nutrition was, it's not very attractive as a discipline, as a specialty, So we don't have as many nutritionists as, dermatologists or surgeon or cardiologist, unless there are more animals which would require a nutritionist than another specialty. But the way it is, to me, the very specific skills of a nutritionist is how to calculate properly. It takes a lot of time. It takes very, very short time to calculate and get a recipe. It takes years of experience or calculations to make sure that the recipes you've made is properly formulated to cover requirements. And this is very time consuming. It's like, any vet can do any kind of surgery. But if I would decide tomorrow to go for a TPLO, maybe I would do it, maybe not. But certainly not well the first time, not even the 10th, anyway. And it would take me ages to do it very well. And so I won't even try. But what is important is, as a vet, even as a specialist in nutrition, if I have a dog and he has a problem, I would think, okay, I can diagnose. My idea is I need this treatment, and I will ask someone to do it properly because I can't do it myself. And doing this in nutrition, you would gain, spare a lot of time. That's the first thing. The second point is, during the last years, we've tried to develop a training for vets that they could recognize quite easily when there is a need for a nutritional prescription. And it's quite simple. It's not easy to make people come and listen to that because their feeling at first is that it's nutrition, it's boring. And so the idea and the whole challenge is to make vets understand, in an hour training or an hour and a half, we can make you target the right people and the right pet. And just for that, you will be able to identify if they need a nutritional prescription or not. Which one is a second story, but at least this, then you don't lose your time trying to target the wrong ones. And when you try to change the food of a dog or a cat, well, people don't see why you should do that because there is no problem. You are losing your time and energy, and people don't have a very good opinion of you. So this is the first step to me. And of course, the second step is to have a bit of training, because nothing comes just thinking about it, And so when the vet wants to go a bit further, then a bit of training is necessary to understand. And at this point, I think it's interesting to make them able to go and get training on the major situations that they have to face every day. So again, we've built a training in France for the 20 most common clinical situations. And doing this, of course, it's kind of a one-day training, so it's very quick. But the first hour is always for this nutritional evaluation to recognize if you need a prescription or not. And then you have this short time training for 10 or 20 situations in cats and dogs to see, just why. And if they have questions, of course, we're happy to answer. But definitely kidney disease, diabetes, pancreatitis, chronic enteropathies. Maybe we'll go on this one. Urolithiasis for cats, especially. All these kinds of problems. And when you have two diseases as well, because, there's very often the blue bag or the blue food for the blue disease and the red one for the red disease. But what happens when they have the two? So there is no purple. It's not a purple disease when you have the red and the white and the blue at the same time, So to make people understand, at this point, they need a specialist in nutrition, and it's possible. It's possible. There's no problem. It's fine. It's our job to do that. So maybe most of the time the vets don't even think it's possible, but it is. There are very often situations where we can consider 1, 2, or 3 diseases at the same time and formulate nutrition in a way that you can consider all the points and take them into account and get a solution which is well tolerated and provide a much better well-being of the dog or the cat.
No, that's great. And I think that is really, I think the future, because you mentioned chronic enteropathies, right? I mean, the last few years, so many publications came out that if there are multiple diet trials, right, we kind of going to be able to at least manage some of those animals long term. So I think that's why nutrition probably is going to be, also more and more pushed on veterinarians, right? So what can they do now? So you said there's those trainings in France, for example. But if somebody's now in private practice and says, hey, now, okay, I need to really do more nutrition. Where could they start? Where would be a very good starting point? Is there resources, is there special books you could recommend, or are there like internet sites, feeding recommendations that would be as a very first step at least, to say, okay, now I understand why this is important.
I don't know the similar things in English. I have, unfortunately, but if you do, please tell it. I'm sure there are plenty that I'm not aware of. What we offer in France is training in short sessions, that's 3 days sessions. We have close to Paris, and we organize that in a place called Avetao. For 3 days, we have either the clinical nutrition or the basics in nutrition, like normal dog and cat, to get more, to get more information and go deeper in nutrition. It's also 3 days. So we don't make anybody become a specialist in 3+3 days, of course. But it's a very good starting point, I think, if people want to invest a bit of time in nutrition. It's not compulsory. They don't have to do all that at first to be starting with us, but definitely interesting to go in that direction. Books, I've done it in French. I've published one a few years ago, and it was already the second edition. I'm pretty sure there are others and plenty in English. I would recommend any vet who want to go on nutrition to read any of them, any clinical nutrition book, but be very careful of who has, it's not written, but edited. So a lot of these books have been edited by the pet food industry. And that does not mean what is inside is wrong. That means what is inside is a point of view. So it's generally right, but there is much more which is not in the book.
Let me talk a little bit about homemade diets, because owners, right? So what is the owner expectation nowadays? I mean, did it change over the last 5 to 10 years? I heard that more and more owners want to home cook. How do you approach those owners, and if they want a therapeutic diet, but they want to home cook?
Yes, I think that what has changed really in the last 10, 15 years is probably the place of the animal in the house, in the home. And so it may depend on the countries, but the last publications we have, it's this nice study where they focused on how habits have changed between 2008 and 2018 is tremendous. Like the part of homemade diet, mostly as a mixed diet that people feed a bit of pet food and a bit of homemade. It became it became the first way to feed pets. Not only in France, it was the case in France already. We published it was in the late 2006-9, but this study is from the English-speaking countries. So maybe others would give different numbers or proportions, but it does not really matter. What's important to understand is that people have their animals, more and more animals with them, and they want to provide, feeding is something very important. It's more than just providing food. You provide food to survive, you feed to get a bond. And probably this is one part of the reason why people are so involved. And others may be the suspicion about the industry, that's probably the second reason. And also the diversity of the offer as pet food, which makes people not really confident or helped in choosing what the best would be for their pets. So maybe a bit of everything. I don't know. I'm not a psychologist, but it would be interesting to get an opinion on that. Anyway, definitely people are happy to cook or give the same food as what they have to their pets. Let's turn it this way, probably. And doing this, of course, will lead to mistakes, errors, wrong formulation of the diet. People have not much clue on nutrition for themselves, and dogs and cats have special requirements. So it's absolutely normal that they don't have really the right information, you know. I don't think this is very surprising. It's common to hear that, these owners, they do very strange things. But most of owners are first owners, that's pet owners, I mean. They call themselves pet parents, but they are first parents, if I can say it this way. And so when you have a pet for the first time, why and how should you or could you know everything? I don't think it's very possible.
So what are common mistakes that you see, or common, things that you think it's really, maybe dangerous almost even, right?
Feeding a homemade or mixed diet, that's the both. We can define that maybe. So I would separate. Homemade is people cook at home mostly from ingredients you can get from the supermarket. Mixed, you would give pet food, either kibble or wet food, plus homemade parts. So plus ingredients you get from the supermarket for yourself as well. I would say the first error is definitely to consider for homemade diet. The first error is to have no clue of what ingredients you have to provide to a dog or cat. So when people feed themselves, they think about, I will buy this food and this food and this food, like meat, veggies, carbs like rice, pasta, whatever, or manufactured stuff. For dog or cats, as their requirements are not ours, they are still biologically carnivores, so they have different requirements. And when you want to feed them easily, like basically meat, veggies, and rice, for instance, it is possible, but you miss two ingredients. And this is very commonly forgotten by people because they just don't know it. They don't forget. They just don't, they do not know. The first is a source of essential fatty acids, which can be brought by a vegetable oil. So as olive oil is very popular and it's supposed to be nice, it's the first one they would give. Unfortunately, there is no essential fatty acids in olive oil. And even for us, if we have to have essential fatty acids for a nice skin, hair, whatever, better using canola oil or soybean oil than olive oil. That's one. And the other part, of course, the main one, is to not take into account that you have to provide minerals, vitamins, and trace elements to this dog and cat. So this supplement, it's usually called mineral vitamin supplements. It will provide calcium plus phosphorus in some stages, 12 vitamins, 6 trace elements. And it's not like a 1 week a month or a 2 month a year. It's a daily basis. So if people don't do that, then we'll go to deficiencies. The first is a calcium deficiency. You would go to a secondary hyperparathyroidism and lead to osteofibrosis. That's the main easy to understand, I guess, for that. But a lot of other deficiencies would lead to bad immunity, to a bad hair coat, to a bad skin, to digestive problems. The list is very long.
And so, what do you think about all those recipes that people sometimes find on the internet or some books?
Very, very, very often it's unbalanced. Very often, just because the ideas, ideas, because it's only ideas, are not It's not based on calculation. And if you calculate these recipes, you see it's deficient. So even if there are the requirements, there is a range, it's not like the milligram of calcium, no. But of course, there is a minimal and sometimes a maximal, actually. And definitely, I don't know why people think they are nutritionists just because they have a couple of dogs at home for 10 years. I have plenty of things at home for 10 years. That doesn't make me an expert in these things. And it's definitely the same with dogs and cats. So that's the main problem. This is number one. And then we have people, the other problem is a bad choice of ingredients and amounts. Okay, that's of course. So the dog will be too thin or too big, or would have a muscle loss. When you look up the eyes here, and your dog has this, instead of being bumpy or flat, it's like curving inside. Then this means you have to go back to the protein requirements of your pet. It's not covered.
It's time for our famous 3. At Allura Pets, our commitment to biotechnological innovations empowers you to craft superior products that redefine pet wellness standards. Whether enhancing nutrient bioavailability, promoting gut health, or boosting immunity, our science-backed solutions give your formulations a competitive edge in the pet market. Trust Allura Pets to deliver scientifically proven ingredients that elevate your portfolio to new heights. Visit us at www.allura.bio/pets to learn more.
We could actually talk probably about this for hours. You have to come back one day. Let me just give you one final question. Protein, right? You mentioned protein, right? I think there's a belief recently that the more protein, the more fats, the healthier for dogs and cats. Is there a recommended protein is it more better or general? What is your thoughts about that?
Actually, if you go to the metabolism with cats and dogs and you look for the requirements, you will see requirements for protein, lipids, energy, and micronutrients like essential fatty acids, amino acids. Okay. So there is a minimal amount of protein to cover this requirement. And then you have to consider the energy and the way you provide energy to a dog or a cat. If you take a cat, and most cats until very recently were mostly fed themselves, having little praise. So the energy in a prey for cats come more than half from protein. Let's say half, more or less half. 47% from lipids and a tiny amount from carbs. And you cannot really, if you keep a balanced diet, you cannot really exceed any protein requirement. There is no maximal. So you can't give too much protein to a cat or dog. For both, there is no maximal. There are other topics we can talk about, but based on the requirements and the maximal level, there is no maximal level for protein. In dogs, there is no maximal level for cats and dogs. In dogs, the only situation where protein may not be reached, not be too much provided, is of course when there is a disease such as a kidney disease, of course, and the same for cats. You cannot overload it at this point, the kidney, of course. But the only situation in dogs is when you feed dogs a high level of protein in a dry diet, and you make this dog hunt, exercise for the whole day, running after the wild, the venison, the deers, whatever. In that situation, they may become dehydrated and go for acute renal disease. It's the only situation. But if you do the same, providing wet food or water, and provide no carbs, like dogs fed with high level of lipids, which is the most interesting energy when they have to exercise a lot and spend a lot of energy, and protein, then nothing's going to happen. And this is published. It's even more interesting for these dogs, which have a high level of energy requirements. It's even better, and they synthesize their glucose from protein. And they do that pretty well, being quite spare, which is interesting, as this has been published in New Zealand with shepherd dogs not long ago, actually. And they do very well. They do better than if you provide a lot of carbs. They are made for that. It's the same if you want to see how they tolerate or how they can use the energy you do that with sled dogs. Sled dogs are fed a tremendous amount of lipids and protein, but a very small amount of carbs. And that works very well. And if you don't do it this way, it doesn't work at all, and they go on diarrhea.
Well, that's beautiful. I think that is exactly that shows why this clinical nutrition experience is, right? And there's not one concept fits all, and it's a beautiful example.
Yes, actually, I think it's good to go back to biology and to high requirements animals if you want to typically understand them. And this is all about nutrition. If you talk to any kind of nutritionist in the world, they would probably manage the thinking the same way. Because when you take an average companion animal, and especially a dog, they are very, very tolerant. And it's not possible to do that anymore, of course, but it's been published in the beginning of the 20th century. You have a dog which had no food for days and months, and of course he lost weight, but nothing else happened. They're so tolerant. These dogs are so tolerant. But it's not because they can tolerate extreme malnutrition, then it has to be a rule. And it has to be considered as the rule and example. It's just an example, nothing else. And definitely when you want to see what biology means, it's more interesting to go to high production animals, and a high production dog can be a high exercising dog or a growing one. And it's the other way of looking at them. It's very interesting at this point. And we can maybe go to the GI problems we have these days.
We can, yeah. But unfortunately, we're already at the end of our episode, so I think we need to invite
That will be
you
for
back.
another time then.
We need to invite you back, and then we can talk mostly about chronic GI disease, right? So that'd be great.
That would be a pleasure.
Okay. Geraldine, thank you so much. I think I learned a lot. I think this is actually a beautiful example how this all comes together, right? From the clinical perspective, from understanding expertise, and why nutrition is so crucial, right? So with this, I hope you're going to come back. Maybe we can take one episode one day in a few months about specifically GI disease, because I think that is really an important topic, and I think a lot of veterinarians are going to seek advice from nutritionists. So with this, I thank you everybody for watching or listening to us. It concludes another episode of the Pet Food Science Podcast, presented to you by WiseNetics. Thank you for joining us today. Please sign up for be aware of future episodes. And until next time, I'm Jan Skudolski, and goodbye.
Goodbye, everyone. Thank you for the invitation. It was nice.